Hello, my name is Tariq, and I'll be discussing how medical students speaking up in the operating room can impact patient safety. In the OR, students are presented a unique opportunity to experience the surgical environment firsthand. However, before starting, students are rarely taught how or when to ask questions or how best to assist in the OR at each moment. This is understandable since attending surgeons are typically already teaching their residents and supervising other actions in the OR. This study seeks to explore how medical students develop their voice to speak up or decide to remain silent in the operating room, as well as their interactions with other surgical team members. We conducted a qualitative study employing constructivist grounded theory using semi-structured interviews with medical students and residents. We've completed 22 interviews thus far. Subjects were recruited on availability basis, and inclusion criteria focused on students with clerkship-directed operative experiences and seniors in surgical residencies. We iteratively team-coded the transcripts, analyzed the data, and developed themes on students speaking up in the teaching OR. In regards to our results, we decided to focus on 4 themes today: fear of evaluation, reading the room, priorities, and patient safety. Next to them, we have OR context to better understand these themes, as well as quotes that represent these themes. In regards to fear of evaluation, we found that the best context that this quote arose in was the pressure to remain silent to avoid infringing on surgical hierarchy, as well as to avoid a worse evaluation brought on by speaking up. So this student discussed how people in the OR witnessed the break and steer of field 2. And if they didn't say anything, then it wasn't my place to say anything, describing the fear of infringing on the surgical hierarchy, as well as evaluation. Additionally, we have reading the room, which we described as interpreting attending mood, social cues of the OR, and other surgical team members. This student describes a situation in which they were relied upon to close a donor site. They had some questions as far as what to do, but they noticed they were highly focused over there at a different surgical site, so I just figured it out myself. I didn't speak up, and maybe I should have. And then, following priority, this was a more commonly resident scene perspective in which patient safety is the priority and should promote speaking up from all perspectives, even novices. This resident recalls that they have never seen someone get angry or someone get reprimanded for speaking up for the patient's sake. And then lastly, we have the theme of patient safety, which in this context was understanding how the impact of certain actions can affect patient safety and promote students speaking up. This resident recalled how the medical student reminded the team to place the drain when it was clear everyone else in the operating room had forgotten. Initially, we found that concerns for patient safety seemed to overcome any friction to speaking up in the uncomfortable OR environment, even for a novice. However, we found further on that other factors such as attending mood or fear of evaluation may in fact deter students from speaking up, even in the context of patient safety. Next, we have our summary, which lists other results points and takeaway points that we wanted to describe, the 2 of which that are most important for this presentation are students can and should contribute to patient safety in the operation through observation, anticipation, and speaking up. Additionally, the impact of other factors present in the operating room may deter appropriate students speaking up in patient safety contexts by preying on novice insecurities and worries. So these examples are the fear of evaluation or disrupting the hierarchy, as we discussed prior. Lastly, there are moments in the operating room for speaking up versus staying silent that students are expected to identify and thereby act accordingly and not told. In conclusion, we suggest that implementing behaviors prior to the beginning of an operation can promote students speaking up and should be highly considered by attendings as it can positively impact patient safety. Additionally, clerkship should seek to clarify expectations between students and attendings in the OR. Students will be more likely to speak up if they do not have the fear that they will be harshly evaluated for speaking up for concerns of patient safety. This study was conducted in a teaching hospital with close working relationships. Data collection relied upon the subject's recollection of prior experiences. Thank you for your time.